Hello, my name is Kristin Urquiza. I'm the co-founder of MarkedByCovid. And I want to share with you our position on the president's decision to end the COVID-19 health emergency, which will cause more death and disability. If you agree with us, please share this video and urge people to follow MarkedByCovid for more ways to get involved. I'd like to start by saying, on behalf of millions of people in the country who have lost a loved one, the Biden administration needs to reconsider ending the COVID-19 health emergency. COVID-19 continues to ravage the country, causing 500 deaths daily and countless other survivors who are now experiencing disability. On June 30th of 2020, I lost my 65-year-old father, Mark Urquiza, to COVID-19. Following his death, I invited the governor of the state, Doug Ducey, to the funeral. My hope was that if he could see just one family destroyed by a COVID death, he would have the heart to protect other families. At the time, Governor Doug Ducey was standing in the way of local leaders from enforcing public health protections through Executive Order 2020-36, issued on May 12, 2020. His decision was directly responsible for my father's death. While my story in Arizona is tragic, it is far from unique. Across the country, responses to COVID-19 continue to be abysmally inadequate and have resulted in countless unnecessary people getting sick, staying sick, and dying. For the third year in a row, COVID-19 was the #1 killer of cops, a leading killer of children, and continues to eat away at life expectancy for everyone. These losses are a result of policy choices. Allowing the health emergency to end will only exacerbate the pandemic, and the burden will fall disproportionately on people of color, disabled people, the elderly, the sick, and the poor. These realities alone underscore the need for a concentrated effort to prioritize responding to the pandemic in an equitable and just way. COVID-19 cases and deaths are currently drastically undercounted, yet even the numbers we have available are unacceptably high and reflect that we are still experiencing a health emergency. The World Health Organization agrees. While we have made gains, we must stay the course. We need to continue the health emergency and expand policies that adequately protect people in this country. Immediately, we need proper surveillance systems for COVID-19 and monitoring for new variants of concern to eliminate the barriers to vaccines, treatment, and uptake, to invest in infrastructure to provide clean indoor air, especially in public spaces, to solidify a social safety net that prevents people from losing essential services like protections from evictions and access to care, telemedicine, and more, to issue an independent commission to investigate our pandemic response, and to recognize the loss of life and declare a national day of mourning to memorialize our losses. The Biden administration's eagerness to move on by allowing the expiration of the emergency will jeopardize what progress we have made and lead to more unnecessary pain, suffering, and death. There is nothing more I would rather do than move on from this crisis. Sadly, we are not there yet. We are still in a pandemic. Thank you.